Hey everyone, Dr. Hanisha here. Thank you so much for joining me on my podcast, Mahan Health with Dr. Hanisha. Mahan literally translates to great in Sanskrit, and it only makes sense to have the absolute best when it comes to your health. My goal is by you listening or watching this podcast, you're getting just a little bit closer to achieving Mahan or great health yourself. This podcast is all for you, so please make sure to comment what you'd like to learn more about so I can get a guest on the show who's an expert in that field, or I might even talk about it myself. I do see patients and clients all over the world virtually, so please make sure to book your free 15-minute phone call today to see how you can start achieving Mahan or great health yourself. All right, let's talk about the episode for today. Today's episode, I had the opportunity to interview an esteemed medical colleague, Dr. Kunal Sood. And we were talking all about pain and more conventional and less conventional options to treat pain before opioids and surgery. So as we know, chronic pain has become a huge epidemic in this country, and the opioid crisis is absolutely out of control. And so what we want to start doing is use ways of healing pain or treating pain in more natural ways before we resort to things like opioids or even surgery. So a little bit more about Dr. Kunal Sood. He joined the National Pain and Spine Centers after completing his interventional pain medicine fellowship and anesthesiology residency at Wayne State University's Detroit Medical Center. Dr. Sood is double board certified in anesthesiology and pain medicine. Dr. Sood was drawn to anesthesiology because of the diverse cases, procedure variety, and helping patients navigate a stressful time in their lives. While practicing anesthesiology, he was attracted by the pain management aspect of the specialty. Dr. Sood's goal is to quickly diagnose the source of pain, discuss the most effective evidence-based medicine, diet and lifestyle modifications, and create a personalized, thorough treatment plan for each patient, making modifications as needed. He understands that living with chronic pain is debilitating, and by diagnosing and treating the cause of his patient's pain, he hopes to immediately bring back their quality of life. He is passionate about health and fitness, so on his downtime, he spends his time playing basketball and tennis. He also loves to stay active by traveling, trying new restaurants, and visiting with family and friends. All right, well, I am excited for you all to listen to this episode. Dr. Kunal Sood is a really cool guy, and I learned a lot from him and a lot of different therapies or treatments for pain. And he's got a great TikTok, so definitely check out his TikTok page as well. All right, well, make sure to rate and review the podcast and let us know about what you thought of this episode, and reach out to Dr. Sood or myself after the show. All right, enjoy. Hi, Dr. Sood. How are you doing today?
Hi, Dr. Hanisha. Thanks for having me on.
Of course, it's so good to have you. I'm so excited to get some of your knowledge in this area. This is obviously like a huge topic, a huge issue that's going on in our country right now. So I'm excited to get your expertise. But before we get into it, tell us a little bit about your journey into medicine.
Right. Well, first I want to say I'm truly honored to be a guest on your podcast. I will admit it's my first podcast. A little nervous, but mostly excited. That's my hint to take it easy on me.
You'll be fine.
So yeah, let me get into my journey. So I will say it wasn't your typical journey. I will say I took an alternate road, and it worked out because it made me who I am today. So growing up in your typical Indian household, which I'm sure you can relate to, Dr. Anisha, my parents definitely pushed me towards medicine. I remember one time I told my dad I wanted to be a basketball player when I grew up, maybe even a Bollywood actor. I thought I could dance, but I really can't. He said, "Beta, you pronounce doctor wrong." And I was like, what? And because of this, I was kind of rebelling against becoming a doctor. It wasn't really until I made that realization myself when I started volunteering in hospitals during my junior year in undergrad at Maryland, where I was just like, medicine comes natural to me. I've always been an advocate for healthy living, eating healthy, and going to the gym. So taking care of patients, helping them heal was an incredible experience. So at that point, I decided, yes, I want to become a doctor. So I went to Manipal University in India, where they had a US program So I completed my first 2 years of basic sciences in India, and I did my rotations at hospitals in New York and DC. Why did I choose India? Well, Manipal is one of the best medical schools in India. It's ranked in the top 5 every single year. It was a great experience living in India, where my parents and ancestors are from. And I will tell you, it was very disciplined. So they had a curfew. I couldn't have, a TV in my room. So it was a very, very great experience for me to live in India. I'll just say that. And it allowed me to appreciate what we have here, like toilet paper, for example. No, I'm just joking. We had toilet paper in India. So then I ended up matching in anesthesiology, a 4-year program at Detroit Medical Center, and I did a 1-year fellowship in interventional pain medicine. So that's how I came to become a pain medicine doctor.
Wow. That is so cool. Well, thank you so much for sharing your journey.
All right, it was a little longer journey than most people probably tell you, but I had to get through that.
No, so many. So you're one of the very few medical doctors that I've actually had on the show, and they're most like naturopathic doctors. We have like a weird, unique journey because it's a different profession, right? It's not what's conventionally known, and so yeah, I think a lot of people can relate to that, and I can totally relate to your parents pushing you towards medicine at a young age, because yes, as that is always the case for most of us Indian Americans.
So note to any Indian parents listening: do not push your kids into becoming a doctor. They will rebel against you.
They will. They definitely will. And then, but I mean, to be fair, both of our parents clearly succeeded. And so,
exactly. It was in our genes to become doctors. We were just fighting. I was just fighting against it.
We were just fighting against it. But yeah, no, it really is something that we could work on as a culture too, not putting that pressure on our kids, for sure. Okay, so what was kind of what drew your interest more towards pain management and anesthesiology?
Sure. So hopefully I don't put our listeners to sleep with this answer. No, I'm just kidding. That's kind of a dad joke. I won't make any more dad jokes, I promise.
Okay, yeah.
So in medical school, my favorite subjects were by far physiology and pharmacology, which is pretty heavy in anesthesiology. As a medical student, you aren't really exposed to anesthesia unless you choose it as one of your elective rotations. So I did the rotation, and it didn't really feel like work. It just came kind of natural to me. What people think about anesthesiologists, they think we just put patients to sleep, and that's our whole job. But you're basically taking the patient through maybe their most stressful time of their life. You're the intensivist in the operating room. You have to know internal medicine, ICU, pain medicine, surgical considerations, how different surgeons react to each patient's comorbidities. It's a high-risk specialty. So what I also liked about anesthesia is you give a medication and it reacts right away. Kind of in medicine, you have to wait months to see the response. In anesthesia, I saw it right then and there. If I wanted to change the heart rate, I would give a medication and it would change it right in a few seconds. There's a wide variety of procedures. You can do nerve blocks, epidurals, central line, A-line, pulmonary catheter. I can go on and on about why anesthesia is a great specialty. But specifically, the part of anesthesia I loved the most was the instant gratification of taking patients' acute pain away. And we did that with nerve blocks, a cocktail of preventative medications, post-op medications. And I really miss following the patients afterwards. And by specializing in pain, it gave me the opportunity to follow up with patients and build a relationship with them. Pain medicine is a very interesting specialty. You don't really learn about in depth in medical school. With the opioid epidemic, we are learning there are numerous other safer ways to treat patients with chronic pain. And I love the research that's going on in pain medicine right now. It's an ever-changing specialty. We now understand how to manage patients' pain by using a multimodal approach and not just relying on opioid medications. This is really what drew me to pain medicine. I love treating chronic pain with the multimodal approach, not just throwing one treatment at the patient, not just giving them opioids and saying, okay, your pain is healed. And to me, nothing satisfies me more than getting a patient's quality of life back. So that's why I did that fellowship in pain medicine, and I'm doing 100% pain medicine now.
Yeah, that's so cool, because like you're exactly right with the quality of life, right? Whenever you're living with chronic pain or any sort of chronic illness, really, your quality of life suffers. And I know for myself personally too, I actually had low back pain since I was like 9 years old until I was about 23. And then after I was 23, and now I'm much older, and I still don't experience any back pain anymore. And, and that has like a definite impact on the quality of life of any person, right? Like there was so much, I never let that stop me from doing a lot of things, but it was still always present. And now I feel like I'm just unstoppable, right? Like I can do literally anything in the world, because I don't experience that pain anymore. So that's so cool that you chose this path.
Yeah, pain can really have a huge impact in your life. It can really, it can cause anxiety, it can cause depression.
Right.
It can really, put a pause in your life. So, part of my job and part of, the doctors at National Spine and Pain Center is we try to really get the patient's quality of life back. And I try to remind patients sometimes it's pain management. So sometimes we can't heal your pain, but we can help you manage your pain and make it more tolerable so you're not thinking about the pain all day.
Definitely. So what would you say are some common risk factors? I guess like some of the most common risk factors for chronic pain in general, and let's start with that, and then we'll go from there.
Sure. So really the risk factors can be broken down into 3 categories. You have your biological risk factors, your psychological, and your lifestyle risk factors. So with the biological, most commonly are female, elderly, and genetics. Our women listeners are probably thinking, why women? So my theory is part of the reason is they're more likely to seek treatment and really admit that they have pain. So that's probably why it's more common in women statistically. Because I'm not saying men don't feel pain, because we do feel pain.
Good to know.
We do have emotions. Psychological risk factors are mood disorders such as bipolar, depression, anxiety, history of childhood trauma. And then you have your lifestyle risk factors. So a high-risk job, low job satisfaction, lower socioeconomic status, stress, smoking. So smoking is definitely something I like to discuss with all my patients that tell me they're smokers, because it can decrease your blood flow, which in turn decreases oxygen and nutrients to the site of pain. So for example, if you have like disc degeneration in your lumbar disc, having limited blood flow can kind of compound that and make it even worse when you're smoking.
Yeah.
So those are generally the risk factors that I look for in patients.
And one of the things that I think you forgot, but one of the reasons why I actually connected with you was diet, and how you talked about how inflammatory foods can also trigger pain, right?
Yes, thanks for reminding me about that.
Yeah, definitely.
I actually use that as a treatment for when a patient has chronic pain, but you can definitely use it as prevention as well.
Yeah, 100%. I know for myself personally, that was actually one of the big triggers, was food. I definitely have a gluten sensitivity. And so anytime now I do have gluten, I get like this joint pain back in my wrists, and like it all comes back. So it is something that can be triggered by inflammation. I would say inflammation is probably, and that's like from smoking too. You get a lot of inflammation from smoking, right? And so that leads to a lot of pain. Like that's like pain is just one of the symptoms of inflammation. So yeah, I know, and I appreciate you bringing up the fact that men and women likely experience the same amount of pain, or it could be different, but just based on statistics, we find it more so in women. And it likely is true. Like the number of men I've seen in their 20s and 30s who experience chronic pain is ridiculous, but they never actually go address it. They never talk to anyone about it. And they're still young. They're so young. They're only in their 20s, 30s, maybe 40s, and they're already experiencing some level of chronic pain. I would say, would you agree with me when I say that low back pain is probably one of the most common types of chronic pain?
Yes, definitely. So at my practice, low back pain, neck pain are probably 2 of the most common. And then you have your joint pain, and headaches is also very common. And just jumping back to your diet, just want to add a couple things about that if we have time. So I get a lot of questions about, yes, anti-inflammatory diet, but what exactly is an anti-inflammatory diet? And I'm sure you can add to this as well, because you're probably an expert in that. So I follow this diet personally. A lot of times I'll tell patients to do something and I feel like I should be following what I'm telling them. So by talking about diet, I'm following the same diet I tell my patients,
Mm-hmm.
which is a Mediterranean diet. But I will add the caveat of limiting dairy, because dairy has been shown to increase inflammation. I do limit my chicken intake, but I would say avoid red meat. So mostly plant-based diet is good. Now every patient is different, so this is just when I'm talking about the studies.
Right.
Also intermittent fasting, which is I follow that as well. That has been shown to decrease inflammation as well. So what I usually recommend to my patients is intermittent fasting. So you can fast for 16 hours. I just skip breakfast. I'll have black coffee in the morning because there's no calories in black coffee. And then I'll eat from noon to 8 p.m. So it's pretty simple to do that. And then just follow that Mediterranean diet and limit the dairy.
Yeah, definitely. Yeah, and the Mediterranean diet is amazing because it has been probably the most studied of all types of diets in general, in terms of research, but also it kind of encompasses everything, right? Like it encompasses mostly like fruits and vegetables with some seafood, and some like a little bit of red meat or a little bit of, you know, lean meats and stuff. And so I think that's kind of like the ideal, like easy go-to, like anti-inflammatory diet in general. But I always like to emphasize the quality, right? The quality of the foods that you're eating, the vegetables, the fruits, making sure they're organic, and then also the meat. If you're
Stop at
having,
Whole Foods.
yeah, having like actual whole foods, yeah, in your diet. And there, Michael Pollan said this quote. I don't know if you've heard it, but I really like to just kind of live by it. And usually, like in general, when I'm giving advice for diet or talking about diet, I'm like, I go with this. He says, eat food, mostly plants, not too much. And I'm like, I like it. You know, it's very simple and just like gets to the point, getting all the, you know, plant flavones and all those things that can help support our health.
Right. I agree.
In general.
There's another quote while we're talking about quotes. There was one more
Yeah.
quote. I think it was by, can't remember who. Let Thai medicine be Thai food, and let Thai food be Thai medicine.
Yeah,
So medicine can be our food too.
exactly. It 100% can be. It was Hippocrates who said that.
I was going to say that, but I didn't want to say the wrong name.
Yeah, it was Hippocrates. And yeah, I mean, he's like considered the father of modern medicine, right? And so, I mean, he was talking about diet, and unfortunately, we've kind of lost that. And thankfully, it's coming back. But yeah, it can definitely be medicine. So I appreciate you bringing that up. And so let's actually like kind of transition. So now someone does already experience pain. Maybe they're already eating more of an anti-inflammatory diet, not smoking, you know, getting some activity in, stretching, doing all the right things. What are some common therapies that you use in your practice in terms of pain management? Because I know you said that you definitely try to avoid opioids as much as possible. So what are some therapies that you use?
So treating pain or chronic pain comes down to really 4 options. One is medications, physical therapy, and within physical therapy, you can include chiropractic, acupuncture, etc. Third category is injections, and then the 4th category you have surgery. So when I first see a patient, I try to diagnose the source of their pain. This will make treating their pain so much easier. So it's like, for example, if you have a nail on your foot and you keep taking Tylenol, your pain's not going to get better unless you take that nail out, right? So I'll diagnose based on history, physical exam. I might order an MRI, and we might get some labs. So treating the pain, after we get the diagnosis, I'll then employ a multimodal therapy with the goals of opioid sparing and avoiding surgery. Now, if we have to use opioids, I will use opioids. I'm not completely against them, but it's usually, you know, in lower doses, and we'll employ other therapies along with opioids. So I'll also use a combination of physical therapy and chiropractor, injections such as epidural steroid injections, for example, which is used for, like you have for low back pain, neck pain, and even like nerve root compression from spinal stenosis. And there's really a number of different injections we can do. So it's not just epidurals. Everyone gets an epidural. It's what is causing the pain, and then we have an injection catered towards that pain. So if you have pain from your facet joints, we'll do what we call radiofrequency ablation of the nerves of the facet joints. We also have therapies like spinal cord stimulation, and newer therapies like minimally invasive lumbar decompression, where with the needle, we can actually take ligament out to open up space in your spine. where before you'd have to do surgery to do that. So now if you have any pain left over, we can use medications like non-steroidal medications, muscle relaxants, neuropathic medications like gabapentin or Lyrica. And like I said, opioid medications do have their place, but you have to use them in the right patient. So the classic example is an elderly patient in whom injections have not helped, physical therapy has not helped, and they're too high risk for surgery. So maybe tramadol or hydrocodone, low dose, they take it a couple times a day. It helps them with their activities of daily living, helps them kind of function and not think about their pain. So you kind of have to look at the risk-benefit ratio with opioids when you're giving a patient those medications. And that's what we look for every visit when a patient's on opioids is this medication still helping you? Is it still helping you live, your quote unquote best life? So that's usually how I go about doing that. And I will say after I do injections in patients, I will start most of them with physical therapy. So the injections kind of buy you a window for pain relief. Sometimes it doesn't heal your pain.
Right.
And with that window, I send them to physical therapy because sometimes physical therapy is what kind of heals you.
Yeah, and I think that's a great point. So one of the things that I've talked about on this podcast before, but I talk to my patients about often is, and my followers in general, is that we, the point isn't to just like mask the symptoms, or the point isn't to like work on the root cause and then like you continue to suffer while we're trying to find the root cause, right? So like ideally we're getting you to a place where you can like make it through, but we're still working on the underlying cause of what is leading to this pain, right? So we do want to support you so that you're not like dealing with the pain all the time, so that you can get through life, but also why are you dealing with the pain? What's going on deeper underneath the surface? And so I think that's a great approach. Yeah. Right.
And like you're saying, sometimes we can't diagnose them right away. So I might have to give them opioid medications just to help them function. Because, I'm not going to leave my patients, crying in pain all day. So if we have to use opioids to do that, then we have to. But where you get in trouble with opioid medications is using them like long term. So you don't want to use opioids for like 10, 15, 20 years because it's like keeping a Band-Aid on for that long. You have to get to the source of the pain and kind of treat the underlying cause.
Right. That's I think that's what's led to the current opioid epidemic is the overuse, right? And so many of our medications that have, have had a lot of great benefits, like things like antibiotics, right? Like obviously it's saved so many lives, but then we overdo it, and that's a lot of our culture in general, is what I always say. We like to overdo everything. So
more is not always better.
It's not. It really is not. And so that's the thing. It's like finding that balance. And if someone's dealing with acute pain, like I've definitely had patients, even like that I've had as a naturopathic doctor, where they were going through surgeries and they were taking opioids, and I've never advised against it because I knew that was what they needed at that time, but I would support them through that process so that they didn't need to take those opioids long term. And that's like where that integrative pain management, or integrative medicine in general, really takes part.
Right. I agree. And you also have to talk about what is the difference between acute and chronic pain. I'll get that question a lot. So like acute pain comes on suddenly and is caused by an exciting event. Like if you fall and hit your knee on the ground or stub your toe, it can be, like you're saying, pain after surgery. And it's most often described as sharp in quality. It usually goes away by 6 months. That's usually the definition you'll see in most of the research and textbooks, is acute pain can last up to 6 months. So if it lasts longer than 6 months, that's when we start calling it chronic pain, because then it starts to turn into kind of a disease. So that's when you kind of have to differentiate, is this acute pain or is this chronic pain? Because in anesthesia, we use opioids liberally because it's acute pain. So you need to treat the pain right then and there, because the acute pain is much different from chronic pain. Chronic pain, you should still be able to function with that chronic pain. It's just more annoying, and you can have exacerbations. Acute pain is always there. It's pretty much 10 out of 10 pain after surgery. So that's when we give those opioid medications. It's also I wouldn't be shy about giving opioids for cancer pain, because that's another area where you can have a lot of acute pain.
Okay, yeah, that's interesting. What are you, we haven't really talked about this before, but what are your thoughts on marijuana for cancer, pain
So
management, or pain
so
management in general?
right. That's a great question. So marijuana, the studies are still ongoing. I will say in my practice, I am starting to recommend CBD.
Okay.
So CBD, difference between CBD and marijuana is it doesn't cause the high feeling associated with cannabis. The high feeling is usually caused by THC. And CBD has been shown in recent studies to decrease pain and inflammation. So pain and inflammation are usually married to each other. That's why we keep bringing up this inflammation over and over again. Because when you have inflammation, you have pain. So to treat the pain, you have to treat the inflammation. But we definitely need more studies before I can, with confidence, say CBD helps. But I will say there's not many side effects to CBD. So I will recommend to my patients to try it. If it doesn't work, it doesn't work. But I've never had a patient tell me it caused them side effects, especially topical CBD. And the most recent study I've seen is it was done in rats, and it did decrease arthritis. So I'm trying to recommend it more for like knee arthritis, to kind of put the CBD around the knee. And some patients actually say it's helping them.
Yeah, definitely. I mean, yeah, I also have used CBD in my practice as well, and found it to be very beneficial for a lot of people. Actually, arthritis was one of the places, but also, again, for arthritis, I also think we need to be addressing the underlying causes of that, which is usually a lot of inflammation, and so then that goes back to that too. But yeah, I appreciate your
CBD also helps with anxiety. That's another interesting. So anxiety and pain are also sometimes married.
Right.
So treating anxiety can also help pain.
Right.
Just like treating inflammation help pain.
Yeah, definitely. I actually personally will take CBD just before, if I'm sleeping in a new environment. So if I'm like traveling, I'm staying in a hotel room, my body and mind it's a little bit more difficult to shut down, and so I'll take some CBD and help me with my stress a little bit, and then I'll just be able to go to sleep, which is nice.
That's great.
Yeah.
That's a great reason to take CBD as well.
Yeah, definitely. Yeah, it's definitely very effective if you're getting the proper quality. I do want to mention that. Again, quality is super important.
Right. So you brought up sleep. Sleep has also been shown to help pain. So I'll tell all of my patients, make sure you're getting a good 7 to 8 hours of sleep, because that's how your body recovers. I'll have patients come to me and tell me, hey, doctor, I'm only getting 4 hours of sleep, and I'm having a lot of pain as well. So until you're actually getting that sleep, your body's gonna have a hard time regenerating and fighting that inflammation. So having good sleep hygiene. If you take CBD to help you sleep, then take CBD to help you sleep. I also recommend melatonin. So just being cognizant and making sure you're getting a good 8 hours of sleep can really help with your pain.
Right. Yeah. And this is also something that I talk to a lot of people about with sleep hygiene. I'm glad you brought that up, is because it goes beyond so if you're having all these thoughts going through your head, it's difficult to fall asleep, practicing things like meditation, which we had talked about earlier before we started recording, practicing that, or like journaling. I'm sorry?
Which I need to start doing as well. Meditation.
Yes. Definitely. I'm going to get you on that for sure. And I talk about meditation so much on my podcast that I'm like, if my listeners are not meditating yet, I would be a little disappointed. But so yeah, practicing things like meditation or journaling, turning off all your electronics. I always tell people to just turn off your phone or put your phone on airplane mode, turn off your computers. And just shut off the day, because so often we keep the day going throughout the night, and it's no, we're done with our work day, we're done with our day, just let it all go and let yourself recover for the next day and be like, all right, today's a new day, right? Getting into that mode.
That's definitely where meditating helps. Meditating can actually help with pain. It gets your mind off of the pain. So that's another added benefit to meditating. Definitely, you shouldn't be having blue light 2 hours before you want to go to sleep. try to finish eating 2 hours before, and just clear your head and make sure you're getting those 8 hours of sleep. And it's really important to sleep at a decent time. I'll have patients tell me, oh, I sleep from 2 to 10, but your body's not built like that. Your body is built with a circadian rhythm, and that rhythm is you'll get the most deep sleep from 10 p.m. to 2 a.m.
Yeah.
So you kind of need to hack your sleep. So if you sleep earlier, you actually maybe can sleep an hour less and get that deep, good quality sleep. So really being cognizant of when you're sleeping is also important.
Yeah, I appreciate you bringing
side
that.
tracking into a sleep podcast now, but
yeah, no, for sure, but it's all connected. I'm sorry?
We might have to do a whole different podcast on sleep.
On sleep, yeah, no, I mean, but that's the reality of all of this stuff.
I love my sleep.
I love my sleep too. No, and that's the reality of this, like all of this stuff is that it's so connected, right? So we can't really talk about pain management without talking about quality sleep. And so, so yeah, I appreciate that you brought that up because it really is so important. And getting that sleep hygiene in is key for sure. And then, one thing that I wanted to add was like with meditation. So like, I'm gonna like keep plugging it. Meditation, it doesn't have to be like where you just sit there. Like meditation could be even just like a gratitude practice. And the reason why I bring this up was like because I was in a spin class one time and I really hurt my plantar fascia. Like I could feel that it was extremely inflamed. And like if I don't work on it, I could have issues with my foot sometimes from working out. And so one time I was in the spin class and I was just like, oh, this is really painful. And then I was like, you know what? I am so grateful for my body. I'm so grateful for my foot, for dealing with the shit that I put it through every day. Like, thank you so much. And just like doing that, like helped actually alleviate a lot of the pain, just because I'm like sending those signals to my foot.
I love that you bring that up because, a lot of it is how you look at the pain.
Yeah.
So patients will come to me and they'll just have, the worst outlook on their pain. They're like, doctor, this pain is killing me. I don't want to do anything. I can't play with my grandkids. Like, how am I going to survive? And I'm like, we need to fix your attitude as well. Because you need to look at the pain as something that you're going to overcome. Have a positive attitude. There's a huge mind-body connection. Even some pain syndromes are caused by the brain, we're finding. Like, fibromyalgia, before we were wondering what is causing this, the trigger points in muscular pain. We're not conclusive that 100% is coming from the mind, but a portion of it is coming from the mind, from stress and anxiety. So you can get muscle spasms from stress.
Yeah.
So definitely there's a huge mind-body connection, and I'm glad you brought that up.
Oh, definitely. Have you heard of the book You Are the Placebo by Dr. Joe Dispenza?
I have not, but I'll add it to my list for sure.
You definitely need to. Like, it is so fascinating. Like he really gets into the mind-body connection of pretty much everything, but he talks about pain, and there's like studies that I'm sure you've heard of where there were like orthopedic surgeons who didn't actually do the knee surgery. They just did stitches in the area, and people's pain was relieved just by thinking that they had surgery done. So
yeah, so that's exactly, so the placebo response itself shows you that there's a mind-body connection.
Right.
Because the fact that you can have a placebo response to begin with shows that if you trick your mind into thinking you're having a therapy, and your mind believes that, it'll, get the response from that quote-unquote therapy.
Yeah. Exactly. It's so cool. I love that stuff. Okay, so let's move on to the rapid fire questions. But before we do that, do you have anything else that you would like to add, or any resources that you recommend for our listeners? I definitely recommend You Are the Placebo for everyone.
Yeah, definitely. So what I'll add is, if you have chronic pain, don't wait to get help. The sooner you get to your pain medicine doctor for the help, the sooner you can get your quality of life back. You can visit our website at National Spine and Pain Centers. It's treatingpain.com. If you want to personally make an appointment with me, I work in Northern Virginia. I will be shifting offices to Germantown, Maryland, probably by the end of the year. But if I can't help you, then I can find another doctor in my practice that can help you. So we're definitely the biggest practice on the East Coast. And part of working at National Spine and Pain Centers, part of the beauty of that is there's somebody in my practice that's going to do that therapy. And we're on the forefront of the research, and we're trying the newer therapies, and we're doing a lot of research on all that. So, I love working at National Spine and Pain Centers, and if you have pain, feel free to go on our website or give us a call and make that appointment.
Awesome. Well, and we appreciate you so much for staying up to date on the research and staying very open-minded to all the different possibilities out there. So thank you for all that you do.
My pleasure.
Yeah, it's awesome. Okay, so let's get into the rapid fire questions. These are kind of my fun, quick round questions that I like to ask all my guests. The first question, are you ready? Yeah, it doesn't have, you don't have to answer them rapidly. It's just, they're just a little bit quicker than the beginning part of the interview. So sure. My first question for you is, what does Mahan Health mean to you?
Okay, so I actually have to I didn't know what Mahan meant, first of all. Yeah. So when I started listening to your podcast, I was like, what does Mahan mean? But it means great. Is that right? Great health? Mm-hmm. Okay, so when I think of great or Mahan Health, for me, it's living the best version of your life. And I see this all the time. My chronic pain patients, they're not living their best life because the pain is keeping them from, going on that vacation. They're scared of getting that exacerbation of their back pain, or from walking too much, for example. So when you have Mahan Health, you're really not restricted in your everyday life.
Right. I love that. And that's essentially my goal, is to help people achieve Mahan or great health so that they can live their best life.
Yeah.
Okay. So my next two questions, they could be related. They don't have to be. It's kind of up to you. What was the most difficult health change for you to make, and what are you currently still working on?
So I'm gonna have to circle back to the sleeping.
Yeah.
So for me, that's sleeping better and changing my sleep hygiene. So when I was in anesthesia residency, it was really hard to make that sleep schedule. I was on call maybe 4 or 5 times a month. If I call, I'd have to sleep in the hospital. One time I was up for 30 straight hours, and it really made me appreciate what getting a good night's sleep can do for your health and your body, and really your mood. So now, I really, I try to fall asleep by 10 and wake up by 6, get that 8 hours of sleep, get that good deep sleep. Still a work in progress, but I'm trying my best.
That's awesome. Well, yeah, now you have a few more tools to help support you there.
Start meditating.
Yes, exactly. All right. So my last question for you is, if you could have a commercial about anything, like a PSA on health, what would it be about and
why? Yeah, so it's something I've never really thought about, but if you're giving me the money and the power to make a commercial, then I'll make one.
That's the point of it.
Yeah, so I would show a patient, that's suffering with chronic pain, and one day he just comes across a toolbox, and he opens that toolbox and he sees so many different tools or options for treating, his or her pain, which he did not know existed before. And at the end of the commercial, he kind of uses those tools and gets his quality of life back. So it's kind of corny.
Yeah, no, that's beautiful. I love it. I'm a super corny person, so that gets me really excited. Oh, that's awesome. Well, thank you so much for sharing, and thank you so much for coming on the show. This has been really fun.
That was really great. Thanks for having me. I feel like we didn't touch on everything, so maybe we'll have to do another podcast, like a part 2.
Yeah,
but definitely. Definitely great to talk about pain, especially with getting your insight in Eastern medicine. Yeah. So Western medicine meets Eastern medicine. That's the best medicine.
It really is. Integrative medicine is the future and the past. It's what we really need right now. It's the present.
Awesome. I had a great time talking to you.
All right. Thanks. You too. Take care.
Thanks.
I hope you all enjoyed that episode with Dr. Sood and now have a better understanding of some of the different pain management options that are out there that you can resort to before opioids and surgery. I will have Dr. Sood's information in the show notes below, so make sure to check him out. But that's all I got for you all today. Wishing you all Mahan health and sending you all so much love and peace throughout this year. And I will see you next time.